Let us start with Dr. Soumya Nambiar, who will talk on systemic and ocular associations in congenital cataract. Over to Dr. Soumya.
Good afternoon, everybody. So I do not know, most of them here are pediatric ophthalmologists or we have come here for relaxing after lunch. So anyways, I think pediatric cataract is all the more important because of the visual impairment that it causes and which is a lifelong visual impairment for the child. I think that is the most important aspect of detecting congenital cataracts earlier on. So cataracts which are found within first 12 months of birth is the way we describe a congenital cataract. And a meta-analysis showed that the prevalence of cataract was between 2.2 per 10,000 to 13.6 per 10,000 of cases worldwide. Now, why is early detection important? One, because it is one of the most treatable cause of lifelong visual impairment. And secondly, it's most amblyogenic when compared to other forms of amblyopia. Before knowing the cause of congenital cataract, we should have a little bit, I have just shown the slide to emphasize the importance of embryology in this aspect. So we know that the lens starts developing by 27 days after there is a multiplication of the surface ectoderm and then forms the lens vesicle, which then detaches itself to form the lens vesicle. And in the lens vesicle, as you can see onto your left-hand side, in the posterior aspect, there are cuboidal cells which slowly starts becoming columnar and gives rise to the first or the primary lens fibers initially by 50 days of gestation. And after that, the equatorial cells will form the secondary lens fibers. So importance of this is that injury anywhere between this, that is the first 3 months of gestation, causes the embryonic type of cataract. Unilateral congenital cataracts are usually sporadic. It's the bilateral pediatric cataracts which are frequently inherited or it represents a manifestation of underlying systemic disease. So what is the need to know about these associations? Only a knowledge of these ocular associations will help us to plan the management, help us in looking out for complications and plan an early reference to other subspecialties like glaucoma, retina, or cornea. And a knowledge of systemic associations helps us to guide the systemic workup, appropriate referral to broader specialties like a pediatrician or a neurologist or an orthopedician. Where do you have to send the child? You should know beforehand when you see the type of cataracts. So what is this type of cataract, which is most commonly seen? I'm just going to deal the commonest type. So what is this, if you can, anybody in the audience? It's a blue dot cataract, which is commonly seen with Down syndrome. It's a trisomy 21 associated case. So here, what are the most common ocular features that you see in Down syndrome? So as you can see, the refractive errors, which are most commonly associated with Downs, includes hyperopia, astigmatism, esotropia, and accommodative lag. And because of that, there may be amblyopia. There may be nystagmus also associated when it is detected later on. And anterior segment abnormalities like slanting palpebral aperture, blepharitis, and NLD obstruction can be associated, and don't miss out keratoconus in these cases. A posterior segment examination may show a small optic nerve head, an anomalous optic nerve head insertion, and small cup to disc ratio. Remember to look out for these systemic associations in a child with a Down syndrome. Look out for the congenital heart disease. Look out for death from infection, particularly respiratory related could occur. Hearing impairment could be associated. Sleep disorders, hypothyroidism, dysphagia, and dementia could occur along with Down syndrome. Now this is the second case. So what is this? This is the most commonly seen in Indian scenario is the rubella cataract. So congenital rubella syndrome, it's an important public health problem worldwide with an estimated 100,000 infants born with the disease annually. And in India itself, just look at the incidence, it is around 65.5 to 225.6 per 100,000 live births. And mothers infected with rubella virus during the first trimester of gestation have reported to have 80 to 90% chance of fetal transmission to the child. Rubella infection is thus a leading vaccine-preventable cause of birth defect and fetal death in developing nations. And the most common ocular associations that you have to look for when you see a child like this is microphthalmia, microcornea, and iris hypoplasia. You will see that the pupil it's not dilating much, and glaucoma can occur in 6 to 10% of congenital rubella syndrome. And in the fundus, look out for salt and pepper fundus appearance. Systemically, always look for a deafness that is present, a heart anomaly, which is most commonly a patent ductus arteriosus, peripheral pulmonary artery stenosis. You can have encephalitis, microcephaly, and autism. So this was a paper by Vijayalakshmi et al., wherein they showed that most commonly in these kids with rubella cataract, a microphthalmia, cataract, and iris hypoplasia occurs. And systemically, most oftenly you see the patent ductus arteriosus. So the classical triad of congenital cataract, hearing impairment, and congenital heart disease is seen in 10 to 50% of laboratory confirmed cases of congenital rubella syndrome. And how do you detect it? It is usually to get a diagnostic evidence of rubella virus is a nested reverse transcriptase PCR of lens aspirate. It is the most sensitive and rapid technique for detecting rubella virus. Genetic testing should be always contemplated in all these cases whenever you find a bilateral pediatric cataract, because you may not get a cause for all of these cases. So sometimes a genetic testing have to be done, and do not forget to do a metabolic and infectious testing as well. Next common is the persistent fetal vasculature, which we see. The infant aphakia treatment study, wherein they also looked out for the unilateral cataracts, they found that the persistent fetal vasculature was most common cause associated with unilateral cataracts, and most of them had ocular associations, and most of them had this unilateral congenital cataract. And this PFV can have varied kind of presentation. So you can see how it can be from a small Mittendorf's dot. It could go on to a vascularized posterior capsular plaque or remnant of fetal vasculature in the posterior lens capsule and the optic disc. So it depends upon what type of PFV are we dealing with, whether it is an anterior PFV, a posterior PFV, or a mixed one. So in an anterior PFV, look out for shallow AC, look out for engorged iris vessels, look out for the retrolental membrane and elongated ciliary process. In posterior PFV, always look out for the vitreous traction, optic nerve hypoplasia, a retinal detachment, and microphthalmia. Systemic associations can be seen usually with bilateral cases. Now suspect PFV in any child with unilateral cataract with microphthalmus, and always remember to look out for other causes of leukocoria as well, like that of the retinoblastoma, wherein a B scan and UBM may be useful to look at to detect the calcification. Now this is a case of anterior lenticonus, and you have to look out for the presence of Alport syndrome, which is a basement membrane disease. Systemically, look out for acute hemorrhagic nephropathy and deafness. In fundus, you look for the albipunctatus spots. This is a case of posterior lenticonus with a posterior polar cataract, and look out for the condition of Loeys oculocerebrorenal syndrome. So you have these three associations. Posterior polar cataract management is complicated, so you have to be good enough to detect it. Now this is a case of oil droplet cataract. It is one of the reversible causes of congenital cataract, which if it is detected earlier on. This is a case of aniridia with cataract. And cataract develops in 50 to 80% of patients with the familial aniridia. And what do you have to look for in addition is look for glaucoma, look for corneal vascularization and pannus, look for optic nerve hypoplasia, nystagmus, and strabismus. And genetic testing, which will be dealt with in the next session. I just put this slide to show you that these are the associations that can occur with the genetic evaluation. And these are the other systemic conditions which can be associated with cataract. So thank you one and all.